Okay, next we're going to talk about all on X versus 3 on 6. Now, I've purposefully left dentures out. I think most patients have a fair understanding of what a denture is. Also, a lot of patients that are looking at going into either an all on X or a 3 on 6 currently have dentures. So, we're going to now focus on the two primary ways of doing implant retained full mouth restoration. So let's talk about all on X. All on X, you're going to have what's called fake gums. So your teeth are going to be teeth colored, but you're going to have gum material between the teeth and your actual gums. Versus a 3 on 6, you're not going to have any fake gum material. Your teeth will look just like they're growing out of your natural gums, just like they have been your entire life. So that's one big hallmark difference. A 3 on 6 is also much thinner. It's also thinner this way and this way because we no longer have the fake gums. So what you'll notice inside of your mouth is the prosthesis is thinner. It's a little bit easier to chew, a little bit easier to talk, get used to it. Also, we don't have air exchange over the top of the prosthesis. So if you hear somebody with a all on X and you hear them whistle when they talk, or you can kind of hear an air movement in their mouth, that's because they most commonly have a all on X treatment. 3 on 6 is going to look more natural. That's simply because the prosthesis end is smaller, it's easier to chew and talk, and it looks like it's growing out of your gums. So the look is a little bit more natural. A all on X, when it comes to maintenance, needs to be removed every 6 to 12 months and cleaned. Versus a 3 on 6, you don't have to have it taken out every 6 to 12 months and clean it. In fact, you'll be cleaning it at home just like you normally do. So you'll have to use a water pick and a toothbrush. This is not a free pass to not brush your teeth anymore. You'll still need to do maintenance at home, but there's no required yearly maintenance for it. When we talk about the all on X, it's one solid piece on the top, one solid piece on the bottom, versus a 3 on 6 is anywhere from 2 to 4 pieces. It's independent bridges. Why might that be significant? So let's talk about, heaven forbid, you got some trauma with your all on X. A classic example is the lady winding up the hose and the piece flips up and breaks her entire prosthesis. You'd have to replace the entire thing. Versus a 3 on 6, it's already in segmented pieces. So if there was a traumatic event and one of these bridges were to break, you're no longer replacing the entire thing at the cost of $5,000 to $15,000. You're replacing one independent piece, which typically costs about $2,000 to $3,000. So the potential maintenance, if there's a problem, is a little bit lower cost on the 3 on 6. Another reason why this is significant is what we've learned throughout the years with continued research is your implants in your bone heal much like a broken bone does. So the continued micro movements on those implants after the recovery time is actually a benefit to increasing the strength of the implant. So what you get with individual pieces in your mouth is little micro movements. This makes your teeth feel more natural when you're chewing and talking. It is actually more enjoyable to chew your food because you can actually feel it brushing against your gums. You can feel the micro movements on the bridges. And now we know that this will create ultimately a stronger interface between the actual implant and your bone. So from the onset, these are some big key differences you should be aware of. Let's talk next about cost.